is Dr. Michael Frau, also from Snowy Owl Clinic, to talk about pediatrics for us.
Hi, I didn't bring Charles. Dr. Wong was the main person, but if you guys are interested in pediatrics, I just kind of wanted to do a very quick, brief overview of why you would need a pediatrician and what I end up doing. So first of all, I know you guys live in Drumheller area because you couldn't live in the big city, and I'm sorry about that. I say that jokingly. I grew up in Didsbury. A lot of people wonder why there's a pediatrician in Carstairs of all places, and it's because I did med school online, I couldn't get a job anywhere else, and I had to live rural Alberta. Right. No, I love rural Alberta, and I'm committed to it, and I did not do, you can't do med school online, good luck with it. But one of the things that a lot of people, so there's tons of great family physicians who actually can do what I do just as well as I do, but in fact I do this all day, every day, and I was trained out at a children's hospital, and so some of the things that your family physician might be fantastic at ADHD or mental health or growth and development, but sometimes they're doing so many other things that, in fact, some of the details get lost and there can end up being some questions. So probably half of what I end up doing is dealing with kids with mental health illness, and that includes autism, ADHD, developmental delays, anxiety, depression. And what I will end up saying, what I want you guys to understand is if you have kids or kids in your community that you're worried about, one of the biggest things to differentiate what mental health illness in kids is compared to just normal childhood defiance and inattentiveness is it affecting, number one, their functionality, and that's always in the Diagnostic Statistical Manual of Mental Health Illnesses of getting an actual definition of it, is that it has to affect their functionality. It's nice if they're all here, there, everywhere, but if they're able to get their grades okay, if they're able to get their chores done, if they're able to do a lot of those things, then that's not affecting their functionality. Same thing with depression or anxiety. Everyone has mood swings, puberty. A lot of parents come to me for questions of, my kid is now like staying in their room all the time. Is that normal puberty? Is that depression? And the answer is, how are they doing functionality? And I'm not talking in Fortnite or whatever, Minecraft. I'm really saying, are they still able to get done what they need to get done as a kid? If they're not able to go to school because their anxiety is too much, if they're no longer socializing, that starts to say, okay, maybe there is mental health illness. The other thing as well that I want people to know, and a lot of people really have this vision that mental health, and I did too even during my training, that mental health illness is, do you have it or do you not have it? And that paradigm has totally shifted to talking about everyone has like sadness at some point, and at some point that is clinical, and that's a problem. All right, there's the people that are happy and wake up like after 2 hours of sleep and are happy, and you're like, how in the world do you do that? And then there's people that are a little more mellow, but I want you to understand that it's not, don't think of it as a binary on or off kind of thing. It is at some point in time, we do have to make a cutoff, and I end up saying, okay, we are in the top 5% of children, and that is going to be impacting your school, your future, everything. We should start working on specific treatments. But there are plenty of people who are close to that line that may not actually have the diagnosis, but still might benefit from some of the behavioral geared therapies toward it. And that goes with ADHD. There's people who are inattentive and are scatterbrained, but if they get things done, who cares? It's the ones that don't get those things done that are having issues. So again, a number of family physicians actually do fantastic, and I've got handouts as far as different medicines that are available for ADHD. The medications for ADHD actually work very well compared to medicines for anxiety or depression or oppositional defiant disorder. But if your family physician is comfortable and knows how to use it, they're not doing anything different than me. But when there's some sort of maybe a learning disability or fetal alcohol spectrum disorder, maybe some autism, or there's a diagnostic question about that, that's when I end up walking in and saying, okay, let's clear this up, let's have good evaluations of what's happening at home, at school, everything. And so again, half of my time ends up being with the kids that have mental health illness. And then as a pediatrician, I end up dealing with like your failure to thrive, your babies that are not gaining good weight, some abnormal like syndromes, Down syndrome, Turner syndrome, a few different syndromes like that. And so if you do have, I mean, if your family physician or nurse practitioner is very comfortable with how things are going, great, you do not need a pediatrician. But at some point, if there's a diagnostic question or a management question that we've tried the first line things, just like with Dr. Wong, you've tried the steroids or something, and it's not working as well as you would hope, then that's when you can get involved with a pediatrician like myself. And again, I love rural Alberta. I'm not going anywhere, and so come on by. Carstairs is not that far away, even if we might have taken the slower route in the future. I have been to Drumheller like so many times for the museum and everything, and I have no idea why I still took the slow way. I apologize about that. So, yeah. Do you have any questions about what I was talking about with mental health illness, or some general questions about pediatricians? Go for it.
I just had a question about anxiety in elementary, like how much is normal for that young of an age group, and then when should we be concerned?
Yeah, so again, I absolutely see anxiety down in the elementary school age, and what the main things you should say in my concern is, number one, is it really affecting, like their self-confidence and how they're getting things done? Are they making it to school, or are we not even making it to school? Are we missing 20% of school? And is it happening not just at school? Is it happening in multiple environments? If it's only happening in one environment, that's clinically not going to end up being anxiety. That's going to be probably a very specific issue with either a teacher, a class, a bully, something like that. But if it's happening as well, if they don't want to go to Callaway Park, or they don't want to go to the zoo or something like that because they're too anxious about that, that is a clinical problem and should be addressed. We are doing much better these days at identifying mental health illnesses in kids. So a lot of people are like, well, why are there so many kids with ADHD now or autism? And yes, there is some incidence that is increasing, but we're also much better at catching it than, oh, just suck it up, you're fine, attitude that was years ago. So yeah, if it's impacting their function and it's happening in more than just school environment, then it's something that you'd want to look into.
So I have a question, but it's not related to what you were talking about. I have an athlete who I'm really concerned about making sure that she's getting proper balance. And who do I go to see about that?
For balance is in...
Just to make sure she's getting enough protein, all the
Okay,
vitamins and stuff.
for a diet.
Yes, she's very active.
So most of the time your family physician or nurse practitioner would be absolutely fine. I do believe they would... You also are connected with a primary care network and might have some dietitians available in the community.
Okay.
All of those would generally have enough information to provide for that.
Okay.
It's someone like myself, pediatrician, obviously I would know that as well and be able to provide that, but most of the time you wouldn't end up needing my services. Most of the time that would end up being if there's an allergy or a specific syndrome where you can't take something specifically. Yeah. All right. Well, yeah. Very nice. Thanks for having us here. I think we'll mingle a little bit. And
Do you want to just talk a little bit about like functional abdominal syndrome and abdominal pain in kids?
yes. Oh, I didn't even mention that even
Yeah.
though we Okay. Probably, I mean, after ADHD, my number one complaint is abdominal pain in the school-age child, and we're not talking adolescents, we're not talking under 4. Between 4 and 12 years of age, abdominal pain is like the number one reason. And what I would end up saying about this is that a lot of times we get worried that there's intestines and there's a liver and what is going on with this. But unless we're having bloody poops, vomiting, consistent diarrhea, or a pain that is very, very specific to like appendix side, or If it is a general belly pain that hurts for 10 minutes or 20 minutes and we are crying and it's waking them up in the middle of the night and they can't go to school, there are nerves in the belly as well, not just intestines and all of that. And almost always the mesenteric nervous system that blankets that is where a number of kids end up feeling their stress. It's the headache for kids. And as long as we're not having any of those, what we call red flag symptoms, it is not something that we end up doing anything about. And we call it functional abdominal pain. There are actually specific criteria that you meet of chronic abdominal pain. But if it is a vague pain that comes and goes and has been going on for 3 months and you're not losing weight, you're not having fevers, you're not having bloody poops, you're not throwing up, they're doing an abdominal x-ray might tell you there's poop there, but you might not tell you how long the poop's been there. Getting an abdominal ultrasound almost always doesn't help. And blood work, when everyone says, what about celiac disease? What about some of these things? Celiac is a very specific autoimmune disease that in kids almost always is poor growth. And if your child is still gaining weight, their intestines are still able to absorb, their microvilli are still able to absorb. Celiac is not going to be the problem. I'm not saying that kids don't have celiac. I'm not also saying that they won't develop that. But that is not the current problem if we are having vague abdominal pain that is keeping kids sometimes out of school and that is getting so bad, and it's been so bad for like a year or two. That is functional abdominal pain. Now, you also want to make sure that your child is not constipated, and that is different. And that history ends up, you talk about how big the poops are, how often we're pooping, does it hurt to poop, and what kind of fiber we're eating in our diet. But a lot of times, if the constipation is out of the picture, so many times the belly pain in a vague kind of pattern is going to be functional abdominal pain. And what can you do about it? Number one, you can wait for time, because almost always they will grow out of it as they become older. Number two, in fact, the best therapy is cognitive behavioral therapy. So we're talking counseling, but not just for the kid, it's for the whole family. Because it turns out they've tried some selective serotonin reuptake inhibitors, SSRI medicines, amitriptyline. They've tried a number of different medicines. None of them really do better than just placebo alone. And so most of the time you have to get, if the belly hurts so often every morning and you miss school, what you really should do is come up with a program for your child or for the child, whoever it happens to be, where they have to go to school and they can take a 10-minute break. But unless they're, like, again, having fevers or throwing up, after those 10 minutes, they have to go back to that activity. They do not get to go home. Because so often what happens is they go home and the belly pain goes away for the rest of the day. So that is functional abdominal pain. It is an official diagnosis, even though it is based on the nerves system, not on the actual inner contents of the belly that a lot of us think about.
Maybe a little bit about fevers also, like when to worry.
Yeah. Fevers are normal response to inflammation, and typically in kids that's going to be infection. My rule about when a kid comes into my office and has a fever, I'm like, okay, what to do? What else do they have? Because a fever in and of itself is not something to be feared. You're not going to boil your brains. You're not going to hit what temperature is high enough that it's going to end up being a problem. The answer is there isn't one. Now, you can end up having febrile seizures, and that is almost always a genetic illness that happens in the family of the rise in temperature, how fast it goes up. So if it goes up, if your kid's playing and they've got a normal 36.5 temperature, and all of a sudden within 2 hours they're at 40.1 or 41 or something like that, it's not actually the temperature itself, it's the rate of change that has shown to end up having those seizures. So fever, and there's nothing you can do about that. You have no idea that fever is going to come. You can't just dose your kid with Tylenol round the clock. So if we're worried about that, I will tell you, there's really not much you can do about that unless your family knows about it and it's already happened. But the actual fever itself, I don't get worried until, number one, I don't have a better reason. If we have a cold or cough, or if we end up having a urine infection, you go towards that. If after 5 days I don't have a reason, then I do a workup. And that's kind of standard. If you go to the children's hospital, like, yeah, my kids had a fever for 3 days, but they're running around and looking great. That's nice. Have a nice day. Come back in 2 days if the fever is still going on. If at any point your child is not breathing well, that's you have to look for bronchiolitis, pneumonia, those kind of things. If they're lethargic, you have to worry about meningitis. If there's other things going on, if they're vomiting, dehydration, but overall, a fever is not something that you have to worry about. You don't even have to treat it. If your child is running around and has a fever, you are not doing any harm to them by letting them run around without having Motrin or Tylenol in their system. Please let them run around. If they are lethargic and fever and you're worried maybe this is something much worse, and you give them a dose of Motrin, this is so often happens is that we watch a kid in the clinic for 30 minutes, the Motrin kicks in, they jump up and they start running around, you're good to go, all right? You don't have to panic about a fever. But fevers that last for 5 days and you don't know why, that's where we start to do a workup. That's where we start to worry about the weird syndromes, the Kawasaki disease, some endocarditis, different things that are going on. So a fever for 5 days without a source, and I say without a source because if you know that the child is probably having influenza but still looking fine, influenza can cause a fever for up to 10 days on and off. So that's not something that I would end up getting any blood work or chest x-ray or other tests. So yeah, fevers get us all in a panic because we think our child is really sick, but at the same time, in all the medical world, we basically say, okay, we've got one thing, check. What are all the other things going on? Because this child might not be that sick compared to a child who doesn't have a fever but is lethargic. That, to me, is a much worse condition for a child coming into my office than a child who has a fever and is running around and acting somewhat normal. Yeah, bring it on. Good.
How do you know when it's more than just growing pains?
Yeah, almost always, the growing pains switch between limbs. It might be symmetrical, one side, like both sides. If a child is always complaining of a very specific spot, that is a concern. So if they're always pointing, it's my leg right here. Unlike most growing pains are, it's my leg, it hurts. That's nice. Let's check the legs. There's no bruising, there's nothing abnormal. It switches every night. If there is a very specific place that is always hurting, that's when you would want to have a more bigger look into if there's a bone problem, maybe an x-ray, maybe some blood work. Same thing, again, if you're having any kind of lymph nodes, I mean, if you go to your physician and see if there's any lymph nodes in the groin area, under your armpits, under your neck, or if there's fevers or weight loss, that would be then saying, okay, let's look into it. But most of the time, it's a very specific spot that doesn't change when it's not growing pains.
Picky eaters?
Yeah, the Canadian Pediatric Society just in the last week came out with a very nice statement, and I think it was in regards to the new food guide that Canada put out. But psychologically, between 1 and 5 years of age, kids actually don't eat that much, and we override that as parents and caretakers because we think, oh my, you're not eating very much, we should probably get you to eat your food, and we end up pushing it on them, and they either refuse, they start getting bad habits, and they only eat the things that they like, or they can end up being obese as well because we actually push them through their natural drop in their body mass index. And so picky eaters, if we're talking about 1 to 5 years of age and we don't have concerns for something else. Now, I will say my autistic kids are all picky eaters, and we have to pay attention to that because sometimes those kids will actually starve themselves together to be a problem. But for the kids that are otherwise healthy and are able to walk and talk and you're not worried about their brain development, those kids, you really need to let them just offer them healthy foods, and if they don't take that food, do not offer them something else and wait, because their body is naturally going to tell them they want to eat when they're ready, and it is completely fine to go a week with hardly eating a thing, because when they are ready to grow, they will actually eat, and you don't have to worry about that. That is a question I get all the time. My kid's not growing, my kid's not eating, and you look at the growth chart, and you will notice, like, as little babies, they're like plump up really quick, but after they hit about 6 to 9 months, once they start to run around and crawl, it really plateaus, and their height goes faster than their weight. So if you ever look at a growth chart, they're like growing tall and growing thin, and you think that must be a problem. The answer is no, that's normal. Myself, we probably eat a little too much, and we should give those kids the best chance possible to not do the same mistake.